It almost smelled like he was rotting from the inside.
I didn't know how.
He was just visibly dehydrated. He wouldn't even cry at that point.
To console him, I didn't know what to say.
I would hold my head thinking that it was just going to explode, and I thought I was going to die right then and there.
Next, two medical mysteries that defied the experts.
For more than a year, little Avery Conley has suffered from violent bouts of vomiting and diarrhea. As doctor after doctor insist that he simply has a run-of-the-mill virus, his parents seem to be the only ones who understand just how deadly his condition may be.
Something is so wrong with him that we're gonna lose the little guy.
Then, when Teresa Zadansky finds out she's having a second child, she's thrilled beyond belief, until she's forced to face a terrifying reality that may threaten her life and her baby's.
Why was the pain so intense?
It was kind of like, oh my God, now what? What is this girl gonna go through?
Jamie and Robert Conley are ecstatic when their second child, Avery, is born on January 22, 2003 in Dallas, Texas. Now, big sister Emily has a little brother to play with. But soon after they bring Avery home, the Conleys realize that he's much more fussy when it comes to feeding than Emily had been.
He did have reflux. He cried all the time, nonstop. It didn't matter what we did.
He always seemed to be in pain.
Jamie, a seasoned mom, suspects her newborn is just suffering from severe colic and hopes it will pass. But after a few weeks, Avery doesn't seem to be getting any better, so she decides to take him to see the doctor. He suggests that Avery may just have a sensitive stomach and encourages Jamie to try formula.
The doctors asked that we please try the dairy-based formulas, and that's when all of the trouble started. We were sitting on the couch, and I was feeding Avery, and I had fed him only 1 ounce. It felt like 10 ounces came back out shooting across the room.
You could tell that it wasn't a normal spit up from after a child eating. It was a projectile.
If you'd been across the room, you'd been hit. It came up with such force that it literally would almost knock you off your feet. And it's quite scary watching such a small little baby vomit with such intensity that his stomach just almost literally looked like it was turning inside out.
Well, we called the doctor right away, and they didn't seem all that concerned. It was, oh, Mom, it's probably just a virus.
But the virus doesn't go away. In fact, the vomiting only gets worse. And less than 24 hours after it started, another symptom suddenly emerges.
Within a day of the projectile vomiting, the pure water diarrhea started.
Actually, almost projectile stools. When you're changing them, you better be quick.
Changing the diapers was not always fun. It wasn't normal for an infant to have stool like that.
The smell from his diaper area was just absolutely horrible. It almost smelled like he was rotting from the inside.
The Conleys have never seen anything like it before. Frightened by the bizarre symptom, they take 8-week-old Avery back to see the doctor. They're convinced he isn't suffering from any ordinary virus. This time, the doctor performs a head-to-toe examination, but finds little in the way of abnormalities. He then suggests that Avery may simply have an allergy to dairy products.
The doctor suggested soy-based formula because some infants have better luck with that. The first feeding, we thought, oh great, it's working, because he didn't throw it all back up. But the second feeding, we knew something was wrong because the same exact symptoms started over again. If he ate 4 ounces, at least 2 of it was coming back out.
It was very difficult to watch him go through this, knowing that he's in pain and knowing that something's not quite right, but not really being able to do anything about it except try to hug him and hold him more.
Robert and Jamie can't bear to see their son living in such agony. So, once again, they call their doctor looking for some answers. And once again, they're told not to worry. Avery just needs some time to adjust to the new formula. But when he starts to develop an acute diaper rash, Robert knows his son needs help, fast.
His diaper rash was so bad that he actually had open sores. No amount of cream or paste or anything we could put on it would help. We'd have to keep him wrapped up in a towel for a few days until his skin would heal, that we could put a diaper back on him. He's looking pretty bad. His color's changed. He's a little bit whiter. He looks more emaciated. He's acting much more lethargic. And it's really starting to make us nervous that maybe something is so wrong with him that we're going to lose the little guy before we can figure out what's
In the
wrong.
spring of 2003, 31-year-old Teresa Miller was living in San Antonio and working as a financial analyst. Her whole life revolved around her son, who she was raising single-handedly.
I had a son, Zachary, and we did everything together. I said I would never get married.
But all that changed later that year when she met Frank Zadansky through an online dating service. And though the logistics were difficult, there was an instant spark between them.
I had a job as a truck driver, and I was on the road pretty much all the time. But Teresa and I talked every day.
I basically had a phone to my ear constantly. We just couldn't get enough of each other.
18 months later, Teresa and Frank decide to tie the knot.
I married Frank in January 2005. We started planning our future and talked about having children. And I got pregnant right away. We were ecstatic to find out we were having a girl. The baby was growing. Everything was great.
But in March of 2005, Teresa, now 2 months pregnant, wakes up one morning to a terrifying sensation.
I could not feel the right side of my face. I thought it was kind of odd. So I looked at the mirror and I couldn't feel anything from my eye down to the lower part of my chin. I immediately called my mother.
Teresa said, "Mom, my face feels very strange. I've never had any feeling like this before, and something is wrong."
My teeth were numb, half of my tongue was numb. The numbness felt like a dentist giving you a shot of Novocaine.
Alarmed, Teresa makes an emergency appointment with her doctor.
The doctor basically tapped on my face, looked in my nose, my throat, in my ears. After he did the examination, he said that it was pregnancy rhinitis.
Pregnancy rhinitis is a condition in which a pregnant woman's high level of estrogen causes membranes in the sinuses to swell. In severe cases, nerves are affected, and a patient's face can become numb.
He said to just wait it out, and it should go away in a matter of a couple months, or it could be the whole pregnancy. I wasn't happy, knowing that this could happen for the rest of the pregnancy, but I had all my faith put into him by what he told me.
Although the complete lack of feeling on one side of her face is disturbing, Teresa focuses on the good news. At each and every checkup, her baby seems to be doing just fine.
The baby was kicking and heartbeat was excellent.
At that point, all that she could do is to bear the symptoms that she was having until after the pregnancy.
But in August, Teresa, now 7 months pregnant, is blindsided by a frightening new symptom.
And I turned on the shower and I touched the water with my left hand and noticed it was cold. And I immediately panicked, thinking, uh-oh, something is wrong with our water heater. So then I turned and used my right hand to check it, and it was hot. That immediately sent warning signs to me. The feeling I had on my left side was like pins and needles. It started with my arm, and then by the end of the day, the numbness and tingling was starting to happen in my lower leg.
I was very worried because I haven't heard of somebody having that kind of a feeling. I told Teresa at that point that she needed to call the doctor.
Panicked that something could be wrong with her baby, Teresa checks in with her OB/GYN that same afternoon.
The doctor put me on a stress monitor, and the baby's heartbeat was excellent. We had a sonogram, and she was doing wonderfully. So she explained to me, basically, at this point, the baby was laying on a nerve, and that numb and tingly feeling could happen for the rest of the pregnancy.
For the next month, Teresa does her best to ignore the bizarre numbness and tingling sensations. But the day before the baby is due, she wakes up with a debilitating new symptom.
I started having a headache. I just thought I was having a sinus headache since I was having pregnancy rhinitis the whole time, but the headache kept getting worse and worse. I would hold my head thinking that it was just going to explode, and I thought I was going to die right then and there. Why was this happening, and why was the pain so intense?
Avery Conley is only 4 months old and has suffered from chronic projectile vomiting and diarrhea since the day his parents brought him home. Doctors are convinced that Avery just has a sensitive stomach and prescribe a soy-based formula to relieve his symptoms. But just 5 days after they make the switch, Jamie witnesses a shocking and terrifying new symptom.
Jamie goes to pick up Avery, and he's just totally not responsive. We can't wake him up. Nothing we tried to do can seem to wake him up. It's just like he's permanently asleep.
In a state of panic, Jamie and Robert race their newborn son to the closest ER. As soon as they enter the hospital, nurses begin taking his vitals, and Jamie recounts exactly what's been happening to her son since the day he was born.
I explained in detail that he had the projectile vomiting, the pure water diarrhea, and the diaper rash. He was just visibly dehydrated and lethargic. He wouldn't even cry at that point.
Given Avery's medical history, the ER physician immediately calls in a pediatric specialist. Finally, Jamie believes someone will be able to give her a definitive diagnosis.
The pediatric gastroenterologist came in the room and asked just a very few basic questions, wasn't even in depth. Got a stool sample and left the room.
But her hopes are short-lived.
And he came back in and said, okay, well, we'll send him home and just keep an eye on him, and if anything happens, follow up with the regular doctor. And we kind of sat there baffled as to what was that all about.
The doctor believes that Avery is suffering from a severe viral infection, but they'll have to wait until the results from the stool sample test come back to know for sure. Jamie and Robert head home and anxiously wait for the news.
We got the phone call that says the results were negative, that it was not a virus.
The doctor reiterates the same advice they've heard too many times before, that whatever's plaguing their son will run its course. They just need to give it some time. But over the next week, it's becoming very clear to the Conleys that Avery's health is declining at a startling rate.
He's getting worse day by day. We can't wake him up for anything. And it almost takes two of us to bathe him, because one of them has to hold to keep the child from drowning because he won't wake up. And they don't think anything's wrong with him.
Even more disheartening, doctors aren't the only ones doubting the Conleys' grave concern.
Our family was just more of, no, it's a virus, or no, maybe Jamie and Robert are really making this up, or they're blowing it out of proportion.
And after 4 months of managing Avery's bizarre symptoms alone, the stress is becoming almost too much for the couple to bear.
It was very difficult working all the time, being gone from the family and coming home. Jamie's emotional state is getting worse.
So I was basically handling all of this by myself, trying to handle feeding Avery, making sure I'm still paying attention to Emily and letting her know that she's still loved even though Avery is sick.
When Avery turns 24 weeks old, Jamie finally breaks down and takes him back to the pediatrician. This time, she's more determined than ever to leave the doctor's office with an answer. But the doctor, still convinced that Avery has a sensitive stomach, suggests that Jamie try feeding him a special hydrolyzed baby formula.
Hydrolyzed formula is pre-digested with enzymes, so it's easier for the stomach to digest. For the first few days, he actually started to improve. You could see that he was a little bit happier by the day. He was becoming happy again, and he wasn't afraid to eat anymore. It took a couple of feedings for him to realize that it wasn't going to just hurt his stomach when he ate.
While there is a marked improvement in Avery's overall health, he's still occasionally throwing up. Food allergies still seem to be a likely culprit, so the pediatrician sends Avery to an allergist so they can run a few tests.
The nurse practitioner ordered the blood tests to test for food allergies and common allergens and things of that nature. The 2-week wait to get the allergy results were just awful. Because this whole time, again, you're kind of doubting yourself in the back of your mind, thinking, is it something that we're doing?
When the results finally arrive, they are nothing short of shocking.
He says, well, it's really strange. He has no food allergies. So we really don't know what's going on, but just stay with the hydrolyzed formula.
At yet another dead end, the Conleys can only continue to feed Avery the specialized formula. At least he can keep most of it down. When he turns 8 months old, though, Jamie begins transitioning him to solid foods, hopeful that Avery will finally be able to eat trouble-free.
When we introduced solids to Avery, we started with cereal. And the first feeding was okay, there were no symptoms. And the second feeding, some of it came back out, and we thought, well, maybe it's just the reflux kicking in because his stomach's learning what to do. And then by the third feeding, it all came just right back out. He just vomited the whole meal up.
It's a decisive moment for the Conleys, and they agree that the first step in finding a diagnosis for their son's perplexing condition hinges on the next decision that they make.
We were bound and determined to figure this out if we had to on our own. Basically, we're firing our doctor.
Throughout her pregnancy, Teresa Zdansky has been suffering from a strange numbness in her face and body. Now, a day before her baby is due, she's suddenly stricken by an agonizing headache, unlike anything she's ever felt before.
My headache was just so excruciating. I called my doctor. The doctor said, it sounds like you possibly have a migraine, which could be the onset of labor. Frank was about 3.5 hours away doing a run. So I asked my neighbor if he could come and take me to the hospital. And then I called my mom and asked her to come over and get my son.
I got a phone call from Teresa saying that she was going to the hospital. I was frightened and concerned. If something's going wrong with the baby, could it be affecting her? I told her I would be there as soon as possible.
They hooked me up to a monitor and checked the baby's heartbeat. It was perfect. They felt the baby. She was kicking.
But concerned that Teresa may be going into labor, the doctors insist she stay overnight.
We were really worried if there was some problems with the baby neurologically, because I was feeling these effects with the headaches and the numbness.
The next morning, Teresa's contractions begin, and 1 hour later, she and Frank welcome their daughter, Kendra, into the world.
Kendra was 7 pounds, 6 ounces. When the doctor held her up for me to see her, she stuck her tongue out at me. So I kind of felt at this point, all these things that I was having during my pregnancy, she was making them happen.
Pure happiness is the only thing I can say. The baby and Teresa were both healthy, which took a big weight off of me.
I I still had the numbness and the sensations in my arm and my leg, but the doctor said it would dissipate over a couple of weeks. Don't worry about them.
But over the next several weeks, Teresa's troubling symptoms don't subside, making even the simplest and most routine aspects of motherhood a struggle.
Changing her was hard for me. My left arm would get tired if I was trying to feed her with my left hand.
She couldn't hold Kendra because she was afraid that she was going to drop her. She felt that she couldn't take care of her the way that a mother would take care of a newborn baby.
6 weeks after giving birth, Teresa's symptoms are as acute as ever, and Frank insists she make a follow-up appointment with her OBGYN.
The doctor really didn't have any concrete answer to give us of what was going on.
The doctor said everything pregnancy-related should have gone away. You need to go see a neurologist. And know that if something's wrong, there can be really, really bad consequences to it. I told her that we needed to find the best doctors in San Antonio.
Teresa immediately makes an appointment to meet with neurologist Dr. Praveen Thangata.
Teresa was very anxious because she was having this ongoing neurologic symptoms.
I told him about the numbness in my face and the sensations in my extremities and the excruciating headache.
So I did a detailed neurologic exam where we looked at motor sensory functions, gait, reflexes. I knew Teresa has some neurologic abnormality. So I told Teresa that the next step would be to order an MRI of the brain.
I kind of felt a little relief to have a doctor say that we need some more tests to be run. I want to be giving you the right answer. None of my other doctors did that, but I was really scared to wonder what the outcome was going to be.
I was out in the waiting room thinking of all of these things that we could find out. I was really worried. I just pray that everything will come out okay.
I had a lot going through my mind. Having my daughter only 6 weeks old, having a 12-year-old, how I was going to be able to handle all this together when I did find out what the outcome was going to be.
But nothing could have prepared Teresa or her family for what the test results reveal.
Teresa's MRI showed an abnormality at the base of the brain, which could be dangerous. At this point, I told Teresa that it needed to be taken care and that she needed to see a neurosurgeon.
The fear I had the most was to hear that there was something that was so serious that it could be life-threatening.
It was kind of like, oh my God, now what? What is this girl going to go through? How much more can Teresa handle?
Jamie and Robert Conley have been struggling to find someone who can help figure out what is causing Avery, their 10-month-old son, to suffer from chronic vomiting and diarrhea. Growing more and more distressed, the couple has finally decided to take matters into their own hands.
I started to do research on the internet and find groups on the internet and talk to other moms. And I probably did at least 200 hours of research.
And then, while the family is visiting relatives in Oklahoma, something happens that will change the Conleys' lives forever.
We went for a drive, and I remember to this day seeing the billboard, and it says, OU Children's Physicians, Dr. John Grunow.
And when we got home, she did some research into what his specialty was, and it's gastroenterology. We're living in Louisville, Texas, which is about 3 hours and 45 minutes away from Oklahoma. We pretty much packed up and left. I'm a mechanic. I can get a job anywhere.
I was concerned. What if the doctor was not able to help them? Then they just moved from another state for nothing.
3 months after first seeing that man on the billboard, Jamie finally meets pediatric gastroenterologist Dr. Grunow.
Well,
Jamie was really very frustrated because Avery had had problems since birth, and no one seemed to take the time to listen to her.
For the first time in more than a year, the Conleys are hopeful as Dr. Grunow goes over every symptom that Avery has been experiencing. The combination of severe bouts of vomiting and diarrhea lead him to suspect that the culprit may be Avery's digestive tract. He immediately orders a colonoscopy, a risky procedure for a 1-year-old child.
To do a colonoscopy requires sedation, and the risk is primarily with the sedation itself. There's also the possible risk of poking a hole through the wall of the colon, which would be a very serious complication. So there is risk involved with doing colonoscopy.
As the Conleys wait for Avery's colonoscopy appointment, Jamie follows up on Dr. Grunow's hunch.
She's burning up the keyboard, typing in symptoms, hoping that something will pop up.
There was a specific diagnosis in there that met our symptoms that we hadn't looked into yet because it is extremely rare to have.
The next week, Avery undergoes the colonoscopy. And as part of the procedure, Dr. Grunow takes a sample of his intestinal wall and sends it to the lab. When it's over, Jamie makes a special request.
At the end, in the recovery room, I said, Dr. Grunow, can you test for this disease? I just know.
Dr. Grunow agrees to the testing. And when the results come back 2 weeks later, Jamie's suspicions are confirmed.
The biopsies, in fact, did show a much larger than usual number of mast cells. The elevation of these cells, the increased numbers, led me to think that, in fact, what we were dealing with is a form of mastocytosis.
Mastocytosis is a rare disorder characterized by the presence of too many mast cells, which are found in the skin, lining of the stomach, and intestines.
Mast cells are a type of regulatory cell. They have many different functions. People associate them primarily with allergic reactions.
Mast cells play an important role in helping your immune system defend the body from disease by releasing chemical alarms, such as histamine, to tell the immune system to attack invading pathogens. But if you have too many mast cells, too much histamine can be released, causing the surrounding tissue to become inflamed.
The mast cell in and of itself is not too much of an issue, but when it becomes activated, it releases a variety of different chemicals. The things that tend to activate mast cells are allergens, pollens, different foods. Because of the large number of mast cells in the intestinal tract, there are many symptoms that would accrue. Diarrhea, vomiting would be a common symptom, abdominal pain is common as well. And Avery certainly had his share of the diarrhea and the vomiting.
Dr. Grunow goes on to explain that Avery's diarrhea and vomiting can in turn result in a total lack of energy, making Avery chronically unresponsive and literally putting his life in danger.
If the diarrhea persists and you can't take enough food in, it's inevitable that one would die of starvation, be severely dehydrated. All these are very serious complications.
But one key question remains. If Avery's mast cells were reacting to food allergens, why did he come up negative on all the allergy tests?
In traditional allergy, there is an antibody, and when you do allergy testing, that's actually what you are measuring. In mastocytosis, that antibody is not there in large quantities.
Though Jamie is relieved that Avery finally has a diagnosis, she still has a hard time understanding why none of the other doctors could connect the dots.
Well, mastocytosis is not very common at all. It's one of those diseases we call an orphan disease, since there are fewer than 200,000 people in the entire United States who have manifestation of this disease. And if you are not specifically looking for it, you will never find it.
While doctors continue to research a cure for this rare disorder, patients like Avery are being treated with a new prescription medication.
It stabilizes that membrane of mast cells so that it cannot release the histamine.
In addition, Avery must stay on a very restricted diet. He has to avoid food that sensitizes his mast cells, like dairy, egg, and cheese.
Throughout her pregnancy, Teresa Zadansky has experienced debilitating numbness and headaches. According to her doctors, they were simply the side effects of her pregnancy. But after her daughter's birth, an MRI has revealed a potentially life-threatening abnormality in her brain that requires immediate surgery.
It was really hard because when you talk brain surgery, it's hard to really know what the outcome is going to be.
I have referred Teresa to Dr. Holger Skerhut, neurosurgeon, and arranged to see him as soon as possible.
When I looked at Teresa's MRI scan, there was a mass the size of a small plum between the cerebellum and the brainstem. So it became very clear that we were dealing with a very specific kind of tumor that is found most often in these locations, called the neuroma.
A neuroma is a non-cancerous tumor that grows out of specialized cells that protect nerve fibers. In a healthy individual, these cells support and insulate nerves the way plastic coating does on electrical wires. But in patients like Teresa, the cells multiply abnormally, forming a tumor that puts pressure on the nerves and inhibits their activity.
The brain has 12 cranial nerves. Each cranial nerve has a very important motor and sensory function associated with it. And all these cranial nerves eventually pass through the brainstem. As these neuromas grow, they begin to affect other cranial nerves and can compress the brainstem, so the nerves don't function properly. But we really do not know why these tumors occur.
I was relieved for them to find what was causing all these symptoms, but I was feeling, this can't be happening to me. My mom started crying. I started crying. It was really hard.
My heart sank. I couldn't do anything for her. I didn't know how to console her. I didn't know what to say.
Dr. Skerhut goes on to explain that all of Teresa's seemingly unrelated symptoms were a direct result of nerve damage.
Because her first symptoms was numbness of her face, I felt confident that this probably was a neuroma involving the coating of the fifth nerve, which supplies sensation to the face. But because Teresa's symptoms not only involved her face, but also involved numbness and tingling on the left side of her body, it became clear that the tumor was not only large, but also was compressing the brainstem. All the major motor and sensory tracts passed through this region.
And as Teresa's neuroma continued to grow, it culminated in an excruciating headache.
The headaches are actually related to direct pressure of the brainstem.
After he explained to me what the neuroma did, it all made perfect sense. And so now it's, how do we take care of it?
Because of the extreme compression of the brainstem, it became very important to remove the tumor as soon as possible.
But the surgery isn't that simple. In fact, it could leave Teresa worse off than she is now.
I knew that we had to sacrifice at least part of the fifth nerve, since the tumor was intimately associated with it. Nevertheless, there are other cranial nerves that are quite close to the fifth nerve that could be damaged by removing the tumor. In addition, coma, paralysis, and death were considered risks to the procedure.
I sat there thinking I could just never wake up again, and my daughter will never know who I am. I could never see my son graduate, nor see him get married. That was really hard for me.
2 weeks later, Teresa prepares herself for the risky surgery. And as she's wheeled into the operating room, her family begins a seemingly endless wait.
It was a very emotional day for all of us. Worst fear is she going to make it through the surgery? Is she going to become paralyzed?
When they wheeled her back, it crossed my mind that that might be the last time that I ever do see her.
The operation took approximately 6 hours. Once the surgery was over, I went out to talk with the family. I essentially told them that we were able to remove the entire tumor.
It was very relieving to hear Dr. Screw had removed her tumor.
I was very thankful that my wife was alive. It was a very, very big, heavy weight lifted off me.
But the family's relief is short-lived. There have also been serious complications that will change Teresa's life forever.
During the procedure, we had to sacrifice the 5th cranial nerve, so she would remain numb on the right side of her face. Unfortunately, the 8th cranial nerve, which allows us to hear and gives us balance, was permanently damaged, so she did have hearing loss in her right ear, and she remains deaf to this day. In addition, small areas of the brainstem actually became permanently damaged, and as such, the nerves actually give false signals, and so she now permanently has numbness and tingling on the left side of her body.
The numbness, the pins and needle feeling on my whole left side, it's still there, and it will always be there. But I'm here, and that's what counts.
Although grateful to have survived the ordeal, Teresa can't help but wonder why so many doctors initially misread her symptoms.
Neuromas are relatively rare. Also, it would be easy to misinterpret Teresa's early symptoms as related to the pregnancy. But as the symptoms progressed, the physicians were hampered by the pregnancy, since CAT scans and MRI scans are actually not performed during pregnancies.
In fact, Dr. Thangata thinks it's entirely possible that the pregnancy exacerbated Teresa's neuroma.
It takes many years for these tumors to grow to a size where it can actually start pushing on the nerve, but during the pregnancy, the immunity is lowered. And at this time, the tumor took over, started growing rapidly.
Teresa's tumor developed so fast that without immediate intervention, the results would have been devastating.
Teresa's brainstem had been compressed to half its size. If the tumor had gotten much larger, the increasing pressure on the brainstem would lead to coma and even death.
Today, Avery is 3 years old, and with the proper treatment, he is thriving.
Avery is a normal, rambunctious 4-year-old.
All those doctor's visits were not because I had nothing better to do or I was over-worried. There is something wrong.
You can never discount what a mother says. A mother knows her child better than anyone else. She may overstate the symptoms that she's seen, she may understate the symptoms that she's seen, but she knows what those symptoms are.
Fortunately, Teresa's tumor was caught in time, and today, 4 years later, her future looks bright.
We scanned Teresa and have found no recurrence of her neuroma. Teresa's prognosis is excellent for a long and healthy life.
Though Teresa still struggles with the effects of the nerve damage, her family continues to help her every step of the way.
Being on my feet, walking, and doing the dishes, it's just harder to get around. My family has taken on such huge responsibilities for me.
All of our lives have changed in some way. I spend more time at home and with her. My son, he takes on a lot of the responsibility, but it's brought us closer together.
To assist other patients and their families as they go through similar experiences, Teresa has launched a support group to help raise awareness about her disease.
You need to be your own advocate. If you feel it's not right, keep questioning until you find the answer that you're looking for, because once you find out what it is, it makes a big difference.